Hello and welcome back to GP Video Podcast by Nadia. So today we are continuing with reading the fact sheet about ADHD that we started yesterday. So the next question in the fact sheet is, how is ADHD diagnosed? For a diagnosis of ADHD to be made, a thorough assessment must be conducted by an experienced clinician, usually a pediatrician or psychiatrist, but sometimes a psychologist as well. The assessment process will differ according to whether the person who's being assessed is an adult or a child. So if it's a child, the initial assessment or the initial diagnosis should come from either a pediatrician or a psychiatrist, or sometimes it could be a neurologist as well. But usually it's either a pediatrician or a psychiatrist, while for an adult, it could be not a pediatrician for an adult for sure. For an adult, it would be a psychiatrist or a neurologist. So for kids, we can use three specialists, which are pediatrician or psychiatrist or a neurologist, while for an adult, it could be either a psychiatrist or a neurologist. The key components include a comprehensive interview with the person, adult caregivers, usually the parents in the case of young persons, review of the person's current concerns, including the frequency and duration of the symptoms and any associated behaviors, completion of behavior rating scales. Sometimes when a psychiatrist makes the assessment, you have to see a psychologist first for all the behavior charts and school-related assessments and reports, different reports that they have to look at over the years and years of behaviors. So a psychologist makes the initial assessment, and then the psychologist forwards all these reports to the psychiatrist, and then psychiatrist in a session or two makes the diagnosis, and if needed makes the initial pharmacological medications prescriptions. And then if a kid or an adult is happy on the doses being given and everything is good, no side effects are monitored, kids and adults are monitored for, let's say, 3 to 6 months, everything is going good, stable, then the psychiatrist or the neurologist or the pediatrician can give the authority to a GP to be able to start prescribing the medication for the adult or the child. Just one of the conditions is that the adult or the child should be reviewed by a psychiatrist or a neurologist or whoever is giving the first prescription once a year, so that they are happy with the overall assessment and everything is going good. Okay, what should I expect when I'm diagnosed with ADHD? When ADHD is diagnosed, you can expect the doctor to provide you with information about the disorder, including how the symptoms influence behavior and the causes of the disorder, and any of the treatment options that have been given to you. Okay, so then what is multimodal treatment? For most individuals diagnosed with ADHD, no single treatment is the answer. The most beneficial treatment typically involves a combination of 2 or more of the following. Number 1, medication. Number 2, behavioral therapy, psychotherapy, emotional counseling, social skills training, family counseling and support, parent skills training, educational strategies, time management training, and developmental therapies such as language therapy. This combined therapeutic approach is known as multimodal treatment for ADHD. So, whatever I have told you, out of all of these, 2 or 3 at least should be combined for treatment of an ADHD patient. Of course, pharmacotherapy is one if needed, and all the other ones are in the supportive treatments like behavioral therapy, psychotherapy, emotional counseling, counseling of the caregivers, family counseling and support, parent skills training, educational strategies, time management training, and developmental therapy such as language therapy. So more than one area of allied health is basically concerned. So doctors are involved, psychologists are involved, occupational therapists can be involved, and other needed people would be involved as well. Okay, so this is all we have discussed till now. We'll go to the treatment part of the fact sheet next time. Thank you so much, and you have a very good day, and I might see you before start of the New Year's.